Hi, good morning. My name is Zaida Bastos. I'm the Director of Programs and Partnerships at PWRDF, the Primates World Relief and Development Fund, and I oversee our maternal, newborn and child health program. In May 2014, the Prime Minister of Canada announced the initiative Saving Every Woman, Every Child Within Arm's Length. Global Affairs Canada identified as a priority theme a partnership to improve maternal, newborn and child health. Since the creation of the Millennium Development Goals, there has been historical achievements in reducing child mortality, improving maternal health, tackling HIV/AIDS, tuberculosis, malaria, and other diseases. Worldwide, there has been an over 50% decline in preventable child deaths. However, Sub-Saharan Africa is still one of the regions where maternal and child mortality rates are high. Recognizing the interdependence of health and development, the Sustainable Development Goals that commonly are called the SDGs aspire to ensure that health and well-being for all, including a sustainable effort to further reduce preventable maternal and child mortality. Canada has signed on the SDGs, and PWRDF is one of the Global Affairs Canada partners that is working to improve maternal, newborn and child health. So, usually we use the expression MNCH, which in fact it stands for maternal, newborn and child health. And the maternal, newborn and child health is really a concept that brings the whole community together, and it promotes the continuity of care at all stages. There is the African say that tells us that it takes a village to raise a child, and so this approach to health, to maternal, newborn and child health, in fact embodies this principle. We have really identified that community health workers are the pillar to deliver maternal and child health services. They play an important role in ensuring that pregnant women and their family use antenatal and postnatal services that are available to them. How it works in practical terms is that every village where we work, and for this new program we will work in almost 395 villages. Every village has at least one or two community health workers, and they play an important role of identifying women in their community and provide counseling on healthy lifestyles, family planning, complication readiness, and need for ante and postnatal care. They also help to create the links between the community and the healthcare system in the country or in the province or district where they are operating. So the healthcare system is in fact a joint effort of doctors, nurses, community health workers, family, husbands. They all come together to ensure that there is this continuity of care at all stages of pregnancy, delivery and post-delivery. Let me give you an example. Recently I was visiting one of our projects and I was able to interact with a village health worker and a woman that she cared for during pregnancy and up until delivery. We were lucky to meet the woman that had just had her baby, and the baby was 1 week old. So Samantha, who is one of the village health workers that is part of our program, identified that woman in her village that had signs of early pregnancy. So she went to her house and asked if she had gone to the doctor and see if she was pregnant. Yes, it seems that I'm pregnant. So Samantha took this lady to the doctor. And if you know the area where we operate in South Africa is really the villages are very remote, so there was need for transportation. And the project provides this transportation. So Samantha was able to take this lady to the near clinic that was approximately 11 kilometers of distance from her house. And it was really good because in doing her prenatal tests, she was screened as it's in all patients now. It's almost required in every country in Africa to do HIV screening. So she was screened and she was positive. So in being positive, immediately the nurses at the clinic were able to put her on a regimen of ARVs and scale regular appointments to monitor her throughout the pregnancy. Samantha was there all the time. She ensured that the lady had the appropriate nutrition, that she was taking her medication as prescribed, that she attended the appointments, and when she was not able to postpone them or arrange the transportation, all the stage. Samantha also was able to organize transportation for the delivering day. So when the woman was about to deliver, Samantha was able to pick up the phone, get the vehicle to get her to deliver the baby at the hospital, which is extremely important for women that are HIV positive to deliver the babies in a hospital, because in a facility as a hospital they will take all the precautions to prevent transmission from mother to the child. So once the baby was delivered, the woman stayed at the hospital for the required period of time, and then after that we were home with her 1 week after the delivery, and Samantha explained to us that the woman would have to return 4 weeks after the delivery, and because she was HIV positive, the baby also was immediately put on ARVs, and they would have regular visits until the baby was 18 months old, where he would make the last test to see if the baby had any HIV antibodies and be declared free of HIV/AIDS, or if not, put on an antiretroviral treatment for after this period of age. So you can see that the intervention of Samantha has really ensured that this woman had quite healthy pregnancy and delivery and post-delivery. If Samantha had not intervened at the right moment, the chances of this baby to be born infected would have been far higher, because through the intervention of Samantha at such early stage, the mother was put on antiretrovirals. At the right moment, she was given the medication to prevent the transmission from mother to child, and we are very hopeful that the baby will be healthy, because usually all these steps that were taken at the right moment prevent transmission from mother to child. So we are still waiting to see at the end of the 18 months if this is the case, but we are very glad that we were there at the necessary time to really help this family to come to this point. So, after the baby is born begins child health. And Samantha will in fact be with this family for the next 5 years, and is the time that she will focus on the health of the child. And there are three important aspects that are part of the child health is immunization, nutrition, and child development. So Samantha will be doing that and accompany this family for the next period of years to ensure that this child development is the appropriate, that they are not stunted, that they have the proper nutrition, that they fulfill all the schedule of immunization that they should at this age, etc. So those are the components of the child health that we are dealing with. As you can see, Samantha is a key person that goes through all these stages of the maternal, newborn, and child health. And in fact, PWRDF program and our partners in the countries that we are implementing the maternal, newborn, and child health, which are Rwanda, Burundi, Tanzania, Mozambique, and South Africa, we rely on hundreds and hundreds of community health workers that really ensure that optimal quality health services are delivered at community level, and that there is this continuity of care that links the community to the health services. I really have to thank Global Affairs Canada for trusting PWRDF and the quality of the work that we do and our partners implement and providing the funds for that. But most of all, we have to thank our Anglican constituency that every time that a challenge like that is thrown at them, they respond. And they respond very positively and provide all the support in terms of funds, volunteers, to make sure that our programs happen. Thank you.